good morning, friends. First of all, I am thankful to Dr. Preetham for giving me this opportunity. Now, in this, whatever he has said, one advice I will give you. Whenever you buy a slit lamp, along with the slit lamp, always the operator manual is provided. Don't ignore it. Read it from the cover to cover. You will find a lot of information. Slit lamp is not simple, that just simple one instrument just like a torch or magnification. It has got wealth of information. You can do a lot of examination from this, but you must read the basics first. You must read the operator manual. That is true for any instrument that you buy, any equipment that you buy. So from there I am going to discuss mainly the anterior segment examinations, so various techniques. You can have a lot of information, these already you have seen there. Now there are various lighting systems or the methods that you have to utilize when you are examining the various structures that you want to examine. Diffuse illumination, focal illumination, rectal illumination, specular, sclerotic, scatter and oscillation. Now diffuse illumination is the probably least utilized on the slit lamp. In this, what is done, that the diffuse light is thrown on the patient's eye. General, this gives you a general information, but it gives you a stereoscopic view because you are seeing it through microscope. And in this, there are two types of view, direct and tangential. Now this one, because usually we just simply throw the torch and examine, but on slit lamp also it can be done. And for this, the technique is that large unfocused beam of light is thrown on the part of the examination, that part of eye that you are going to examine. And for this, the slit beam has to be fully open, so it has to be complete circle. And also there is a diffuser, which is you have to put a flap on this, which comes along with the slit lamp. So with that, if you put diffuser, then the diffuse light which goes there. And usually the microscope position is straight on, which is 0 degree, because you are examining straight. And in this, the system can be, sometimes you can also have the illumination system will come from the side, which varies from the various part that you want to examine, which can be 30 to 50 degree. Now this is just the basic optics, that there is the illumination that you are throwing diffuse light, and through the microscope, your area of focus, you are examining stereoscopic view, which is magnified. The main application is general survey of the anterior eye segment, general observation of the surface of the crystalline lens and cornea, assessment of the lacrimal reflex, assessment of soft contact lenses. It is used to examine entire surface of cornea, iris and lens. Useful in getting idea about scar, opacity in cornea, defaults, abnormal blood vessels in cornea, iris and corneal edema. But it's not that this will give you complete examination. So this will give you some idea. Say opacity, I have written scar and opacity. If it is a very minute opacity, with this you will miss out completely. So the other method you have to use. Now the next, that was diffuse, then you have to come to the focal illumination. Focal, it can be direct focal illumination or indirect. The direct helps in visualization of the illuminated point and its adjacent area, done with broad beam or narrow beam, which I will show you just now. Indirect focal examination allows to see the optical cut section of the anterior segment at any angle, and also permits the assessment of the depth of any structure. Now this is a narrow beam which is thrown there. So it is not a diffuse light which is going. It is now you are giving it a narrow beam and then focus light. Now one of the microscope in this slit lamp examination, that I said that usually it is par focus, means where the light is getting focus, illumination system, same place your observation system also is getting focus. But there are certain examination techniques where you have to dismantle this alignment, so that I will tell you later. But in this system, in this focal illumination, it has to be aligned, both at the same place. The beam of light is obliquely directed into the eye and focused, and beam is of three types: optical section, parallelopiped or conical beam. The recommended settings are a narrow slit, angle of slit examination, illumination system can be 0 to 45 degree for observation of detail. You can see the stromal stria. For direct focal illumination with narrow slit, it has slit width has to be 0.1 to 0.3, magnification maximum. This is the most frequently used, and probably most of us simply go straight away to this examination. The angle between illumination and viewing path should be as large as possible, up to 90 degree, depends what you are going to examine. With a narrow slit, 0.1 to 0.2 mm and clear media, the image of the slit and object appear sharply focused at the same time. Slit width and magnification may be varied depending on the object to be examined, and brilliant optical section images to be obtained from the cornea through the rear face of the crystalline. Up to that level, you can get that optical section. The narrow slit or the light from the angle at 45 degrees is used mainly for the cornea, and the various zone that you will see in the cornea, starting from the front over here, that you will see the first the layer of the tear film, then epithelium, then anterior stroma, the posterior stroma, and at the end you will see at the back descendants and the endothelium. The different layers you can, so you can see the pathology, that at what depth the pathology is going to be there. If you have to see the same thing for the lens, again for the lens the angle is little smaller, you have to make it approximately around 15 degree, and here again you can have different portions in the cut sections, optical sections like this. So you will get the anterior capsule, you will get the anterior portion of the nucleus, posterior part of the adult nucleus, then in between you will get the fetal nucleus, anterior and posterior. Sometimes you can also get which is adolescent nucleus, which is between adult and the fetal nucleus, so you can get some images of the adult nucleus, the adolescent nucleus. So these are various depths that you can judge with the position of the nucleus, and then you can judge where is the opacity, where is the location, and what type of opacities you are seeing. The parallelepiped, again, this method slit is little wider. It's not to be very small, about 2 mm wide. In this examination, it is easier to examine the anterior and posterior surface of the cornea for any irregularities. This is again probably not used very frequently, but it can be used so to know the anterior. It can give you full detail of the anterior and posterior surface of the cornea. But always this examination, you should do little higher magnification. And if you want to see the corneal nerve, you can see with this examination with the very high magnification. The conical beam is the third part of the that illumination. This circular beam is used to test the aqueous and flare. Usually, if you want to see the aqueous, whether flare or cells, then the conical beam is usually used. And you can also assess quantitatively as well as qualitatively, both. The main application for this method, suitable for assessment of cataracts, scars, nerves, vessels, etc., and observation by optical system, is also of great importance for the determination of the stabilization axis of toric contact lenses, which these days becoming very popular. Indirect focal illumination, direct and indirect, is there what you saw, that whatever area you are examining, it is all same area getting focused with the illumination system, and that point you was examining. Now with indirect, with this method, the light enters the eye through a narrow to the medium slit to one side of the area to be examined. Here you are not throwing light where you have to examine the area. The light will go behind that and get reflected, and from that you will see the off axis. This light is over here, and so for this examination you have to dismantle the alignment of this the illumination system and the observation system. So there is a knob for that. So you have to disalign that, and then you can any angle and wherever you want to throw the light. Now in this, whatever light is coming from here, so you are observing the light coming from here, and then whatever the field area means pathology you are seeing with this method. The main application for this examination is which is the objects in the direct vicinity of corneal areas of reduced transparency, is infiltrates, corneal scars, deposits, epithelial or stromal defect. The illumination, I told you, narrow to medium slit width, decentered slit, which I explained to you earlier, and magnification depends whatever magnification you are comfortable with. The retro illumination is again very important examination, where it can be again direct and indirect. What it does, that uses an axial or biaxial light beam which shines into the pupil and reflects from the retina, getting reflected from the retina as a fundal glow. And against this fundal glow, you can see a lot of opacities, a lot of pathologies in the cornea or in the lens, means wherever it's in the media, which can be scars, cataracts, corneal vascularization, refractile bodies in anterior chamber, and defects like iris hole. This you can examine. Now here the light has to be focused behind. So that was the fundal glow. This one you can also get retroillumination from the surface of the iris or from the lens. And they utilize the fundus light, the angle between observation and illumination should be kept as small as possible. So both will be mainly, you can't keep exactly same, but more or less it will be close to zero. And if wherever the pathology you want to see, the light illumination system should go away from there. If you are little away, you will get a better observation of the various pathologies. Light is going more or less similar angles, means not very too much. The angle is not much between the two. But if you want to see the pathology here, then you go a little away, because if you throw light from here, you won't be able to see anything. So throw the light here, all reflected red glow which you get against that background, you will see the pathologies in the cornea or the lens, wherever. Now this, as I said, that this reflection can be from the surface or from the fundus, from the retina, or also from the iris or the lens. So based on that, you can have different examinations, and usually whatever is known as the iris reflection is yellow field examination, and from the lens is the white field examination. When the surface you get from the eye, from the lens. Now here, the retroillumination, from the iris, all these pathologies on the cornea will shine through, and you can have that examination. The lens is again from the reflected light from the lens, but since the lens reflected light is white, that's why it's known as white field examination. And the retinal reflection, as you saw earlier, it was all red field. Now this one is probably most of us use this, that whenever you see, so suppose after cataract, in posterior capsular opacification, if you see on slit lamp, examine on slit lamp, is that the optical section, you will not be able to judge how much is the opacity and how much it can disturb the patient's visual disturbance. But if you see in retroillumination from the fundus, these bubbles will be, the moment you see these kind of things apparent, immediately you know that this is the culprit, why the vision is reduced so much. Similarly, with the cataract, you can know exactly what type of cataract the patient is having. So once you do the yak capsulotomy, you can see it's absolutely clear. So these pictures means you must utilize. But for this, preferable to dilate the pupil and then do that. Sclerotic scatter is again some examination method which is least utilized. Here what is done, the light is thrown onto the limbus from the side, and this what it does, the light from the two surfaces of the cornea gets total internal reflection, and that shines to the other side as well as the pathologies in the center. Means wherever in the cornea some transparent media, you can, through the examination system, you can observe. Here again, the two alignment has to be dismantled, the alignment of the illumination system and observation system. So that knob you must be aware that with which knob we can misalign these two systems. For some examination I said it needs alignment, in some examination it has to be misaligned. It is useful to detect the nebular, macular, interstitial deposits, scars, lines in the cornea, hemorrhage in the iris, structures of the sphincter, etc. And slit width should be a little more. Magnification depends what you are usually comfortable with, and illumination maximum. Again, this is a similar example of that. Specular examination, again, this probably most of us don't do it, never do it, because we always think now, because the specular microscopes are separate, so you have to go to that costly instrument and get the picture, the very good picture of endothelium. But believe me, you can do on all slit lamps, you can do this examination and you can have the assessment of the endothelium. What is the state of the endothelium, whether there are Hessel-Henle bodies or not, all those things can be very clearly depicted. For this, what you have to do, it's very difficult to explain over here how to do it. But what is basically based on the principle that when the light is thrown onto the cornea, then some of the light is refracted, and some of the light are reflected. Now some of the light which is refracted but in haphazard manner, so that property is utilized in seeing in the corneal endothelium. Now this is the basic, just I'll tell you 2 or 3 points that make a parallelopiped of the cornea. Means not a very narrow slit beam, slightly broad. So the corneal parallelopiped that you see, where you can see the anterior surface, you can see the posterior surface. And between the observation system, and it has to be aligned, properly aligned, both. Between the observation system and illumination system, the angle has to be close to 60 degrees. Okay. And 60 degrees, light goes from here, patient is looking straight, bisecting your observation system and illumination system. So illumination system like this, patient is looking straight ahead, straight. Then a small parallelopiped with narrow beam, not very narrow beam, but slightly, means about 2 millimeter beam, you will see the corneal parallelopiped. You will also see a reflection onto the cornea of the bulb of the illumination system. Now, if the moment you align this to this, you come close, Always use the highest magnification on the eyepiece. Highest magnification. Turn it to the highest. Sometimes you have to change the eyepiece. Go to the magnification highest. Also change the eyepiece to increase more magnification. And then the moment you align this, the image of the bulb and the parallelepiped, you will start seeing, just focus little anterior posterior, you will see endothelium, you will see the epithelium. Both you will see very clearly. And I can tell you, it's a trick watch. Once you will see this, and there is no need to do routinely the corneal endothelium, the specular microscopy. Once you detect some abnormality, probably you can have more detailed study on that. In this also there are certain slit lamp which can provide you grid. With that grid matching, you can also count the rough estimate you will get what is the endothelial cell count in this. So this is just the theory written, but then whatever I explained, unfortunately I cannot really demonstrate over here, but this means it's probably sometimes you can try it yourself, whatever I have explained. Photograph wise, it comes a very bad picture because it's a very low illumination against the background which is dark. But then once the moment that the light means once you take the picture, really doesn't show properly. And this, it reveals endothelial mosaic and defects in them, elevation and depression in the anterior surface, folds, tears in descent membrane and its reduplication, details of precorneal fluid, can also reveal folds and thickening in anterior capsule. And lastly, the oscillatory examination, where the same thing is just like a slit beam, conical beam, but here instead of keeping it steady, you have to keep on moving. Sometimes the flare and cells will be, and certain foreign bodies or some particles in the anterior chamber will be more apparent with this examination, where you slightly move it, means constantly go on moving and go on examining. Thank you very much for the question.